Healthcare is a woman's issue. Healthcare reform is a must-do woman's issue. And health insurance reform is a must-change issue. So many of the women and men of the Senate are here today to fight for change and to make sure that we have universal access to health care. And when we have universal access, that it makes a difference in our lives, which means that we have to have universal access to preventive and screening services. What my amendment does, and by the way, it is a bipartisan amendment, is makes universal access to preventive and screening services for women available. Now, there's much discussion about whether or not you should get a particular service at a particular age. We don't mandate that you get a service. We leave that up to a decision made with the woman and her doctor. But first of all, you need to be able to have a doctor. So we're for universal access, and this is why the underlying bill is so important. And then when you have that there also be universal access to preventive and screening services, particularly to the top killers of women, those things that are unique to women. If we take cancer, we think about breast cancer, ovarian cancer, and cervical cancer. Also, women are dying at an increased rate of lung cancer. Then there are these other silent killers that come and have had a lethal effect on women, and that's cardio and vascular disease. So we want to guarantee universal access to medically appropriate or medically necessary screening and preventive services. Now, many women don't get these services because, first of all, they don't have health insurance, and number two, when they do have it, it means that these services are not available unless they're mandated by states, or the co-payments are so high that they avoid getting them in the first place. The second main thing about my amendment is that it eliminates deductibles and co-payments. So we eliminate the biggest hurdle, two big hurdles. One, having insurance in the first place, which is the underlying bill, and also co-payments and deductibles. I know of no one in this room who would not want to be on our side on this issue. I want to acknowledge the role that the gentlelady from Alaska has played, Senator Mikulski, Senator Kay Bailey Hutchinson, Senator Snowe, and Senator Collins. We, the women of the Senate, have worked on a bipartisan basis for years, making sure we were included in the protocols at NIH, increasing funding for important research areas to find that cure, to race for that cure, and at the same time to be able to have mammogram standards. What the gentlelady from Alaska's amendment does, and by the way, she's Mikulski, I'm Mikulski. We sound alike, and the amendments might sound alike, but boy, are they different. Mikulski offers information. I think that's important. That's a threshold thing. You have to have information to make an informed decision. But it does not guarantee universal access to these services, and of course, it does not eliminate the high payments and deductibles. So her amendment is flawed. My amendment is terrific. My amendment offers key preventive services, including an annual women's health screening that would go to a comprehensive assessment, including the dangers to women in heart disease and in diabetes. We would hope that when the Senate makes its decision today, it deals with the fact that for we women, the insurance companies also simply take being a woman as a pre-existing condition. We face so many issues and hurdles. We can't get health care, or we can't get health insurance because of pre-existing conditions called a C-section. I'm going to be meeting with an insurance company executive later where his company denied health insurance to a woman who had a medically mandated C-section, and a letter from this insurance company said, we're not going to give you insurance unless you have a sterilization, a coerced sterilization in the United States of America. Madam President, that's going to be an amendment for another day. But I just want to give the flavor and the power of what women face when we have to cope with the insurance companies, or where there are barriers to our getting these health care screening services. So we want to be able to save lives, and we want to be able to save money. We believe universal access, and if you utilize the service, it's because you've had the consultation with your doctor. And at the end of the day, because we do know early screening and detection does save lives, and at the same time, it saves money. And I'll conclude, if we look at heart disease and diabetes, not only cancer, early detection of diabetes means that in a well-managed program under appropriate medical supervision, you very likely will not lose that eye. You will not lose that kidney. You will not lose that leg. And most of all, you will not lose your life. So let's not lose the Mikulski Amendment. Let's go with Mikulski and thank Murkowski for the information, but hers is too tepid and too limited. Madam President, I yield the floor.